We're very pleased today to speak with Dr. Philip Gordon, past president of the ASCRS, I think the first Canadian president of the ASCRS. So Phil, would like to start with a brief discussion of what got you interested in colorectal surgery.
Well, as I was approaching the end of my general surgery residency, I realized that in order to get a job in a major center, I would have to have some training over and above my general surgery training. And for some reason, the chief of surgery in that institution where I was working seemed to have a soft spot for colorectal surgery. I'm not really sure why, because we never had a colorectal surgeon. We'd never been exposed to colorectal surgery. I certainly knew nothing about colorectal surgery. But I thought that in order to maybe garner some favor to get a staff position, that I should take some training in colorectal surgery. And that's exactly what I did, and as it turned out, it's a good thing I like the specialty.
So can you expand on your initial experience in the specialty? Where'd you train and how things go?
Well, when I finished my general surgery training, I went to the University of Minnesota to do a colorectal fellowship, and subsequent to that, I spent some time at St. Mark's Hospital in London, England.
All right. And then you went back to Montreal?
Then I went back to Montreal and started practicing colorectal surgery.
And who are your mentors in your career?
Well, there are a number of people who played an important role in my life. The first that I'd like to mention is Dr. Mark Ravitch. I spent a year with Dr. Ravitch when I was a fourth-year resident. He was well known for being a rather tough and strict chief, and he was very demanding. But to his credit, he also, when he expected you to do things, gave you the commensurate authority along with the responsibility, and he expected me to run the service, and that's exactly what I did. I might also give you a tiny anecdote that after I went back to Montreal, a friend of mine who was an anesthesiologist asked me one day, "Do you notice anything different about you since you came back from Pittsburgh?" And I looked at him. I was rather puzzled. I didn't understand the question, and he said, I said, "No, I don't know anything that's different." He says, "Well, you went away with a jellyfish spine and you came back with a bony spine." In any event, when Dr. Ravitch found out that I was interested in colorectal surgery, he told me that I would have to go and spend some time at St. Mark's Hospital. At that point, I'd never heard of St. Mark's Hospital. I didn't know anything about it. And so I wrote a letter to the then executive director of the American Board of Colorectal Surgery, because if I were going to practice in North America, I wanted to make sure that I would be certified. And I asked Dr. Nigro if I spent a year at St. Mark's Hospital, could I sit for the exams for the American Board of Colorectal Surgery? And Dr. Nigro, in his always very gentlemanly fashion, sent me a 2-page letter that although it's an excellent hospital and although you'll learn a lot, no, you can't. As you can imagine, I was somewhat disappointed. I might even say upset. And so I went back to Dr. Ravitch and I told him this. And he said, "I don't care." He said, "You go to St. Mark's Hospital, you'll learn more about colorectal surgery than you learn anywhere else." And the one thing I did know is that no one ever said no to Dr. Ravitch. So I decided at that point that I would have to find, in addition to St. Mark's Hospital, some training in the United States. And that brings me to the second person who was very important in my life, and that would be Dr. Stanley Goldberg. I first met Stan when I was a medical student working as an extern in Minneapolis at Mount Sinai Hospital. And I then next met him on the boardwalk in Atlantic City during the American College of Surgeons meeting when I was applying for a fellowship in colorectal surgery. And after the interview, he said to me that I would have to come to Minneapolis if I were interested in a colorectal fellowship to be interviewed by the chief of colorectal surgery, who was Dr. Bill Bernstein. So I did just that, and fortunately I was accepted. And by the time I got to Minneapolis, Stan had been just appointed as the new chief of colorectal surgery. So I was really Stan's first fellow. Stan was an excellent surgeon, and he was the one who I would say instilled the religion of colorectal surgery into me, as he did to so many others as well. He was always interested in promoting the specialty and promoting training programs, and his enthusiasm was just infectious. So many of us got infected with his enthusiasm. Another person who was instrumental as a mentor for me was the late Sir Alan Parks. As I mentioned, Dr. Ravitch suggested that I go to St. Mark's, so I certainly did that after my fellowship at the University of Minnesota. And I had the good fortune to do a research project with Sir Alan on fistula and ano. And I didn't realize at that time that how important that would be in order to help promote my career in colorectal surgery. Sir Alan was really possibly, in my opinion anyway, one of the most innovative thinkers in colorectal surgery in the last century. He taught me a lot about fistula and ano. He taught me a lot about the anatomy of the anorectal region, so that was important. And maybe just one more person that I think was very important, and that would be Professor John Gallagher. I always looked upon Professor Gallagher as the Pope of colorectal surgery, and his textbook in colorectal surgery was the gold standard for decades, and indeed through many editions. And I had the good fortune to spend some time with him in Leeds. But when he visited us in Montreal, I had a long conversation with him. And it was really Professor Gallagher who gave me the encouragement to write a book on colorectal surgery. We had published previously a book on anorectal surgery, and he thought that we should have a colon companion. And so he actually gave me the confidence to proceed with that.
Thanks. Why don't you briefly describe your initial and then subsequent experience with the society?
Well, I became involved in the society quite early on in my career. Early on, I sat on many committees. I can't even remember them all. There's probably well over a dozen committees that I worked on at different times, such as the Continuing Medical Education Committee, the Outcomes and Standards Committee. I co-chaired the Scientific Program Committee during a tripartite meeting in 1984. I was the first chairman of the International Relations Committee, and I was the Society's representative for the World Council of Coloproctology. Subsequently, I was very fortunate to have been elected as a member at large for the Society. Following that, and that was for 3 years. Following that, I sat as treasurer of the Society for 4 years, and ultimately became president of the Society. Now, as you well know, it's a great honor to be made president of this Society. But for me, it was a very special honor because, as you mentioned a few moments ago, I'm the first non-American who has been president of the Society, and because of that, it was totally unexpected, so I was extraordinarily grateful. And the other thing that I did with the Society is that they asked me to be chairman of the 100th anniversary celebrations of the Society. And actually, I might just add that the interviews that you're conducting now started during those 100th celebrations to try to get some perspective of those who had been working hard in the Society before that.
You've had a long and distinguished career in the specialty. What would you consider your greatest contribution?
Well, I would have to consider the textbook that I co-authored with Dr. Santhat Devatvangs as the greatest contribution. That was truly a labor of love. It took many years to write the book, to revise the book, and you're doing the next revision, so you know exactly what I'm talking about. At the end, of course, it was very gratifying to listen to and read the reports, the reviews of the book, of surgeons meeting you in the corridors and saying how much it helped them and the patients that they were treating. So that was gratifying, and we were very proud of that work.
Good. Where would you see the society going in the future?
Well, no one has a real crystal ball as to where the society is going, but I firmly believe that if we do excellent clinical work, if we conduct research to expand the base knowledge in the specialty of colorectal surgery, and most importantly, if we have good outcomes, that we as a society will do very well in the future. And I think if we do that, we can become known as the Olympic gold medalists of all the surgical specialties.
As a Canadian, you have a different perspective on the United States and maybe our medical care here. Anything you'd like to discuss about that?
Well, in terms of the difference, the major difference, I think, are really our waiting times. We have longer waiting times to see specialists. We have longer waiting times to get investigative procedures done, such as ultrasound or CT scans or MRIs. Our waiting lists for colonoscopy are considerably longer, and our waiting times for patients to actually get operations are longer. But I have to tell you that despite all the longer waiting times, the ultimate outcomes are really no different. And in terms of the perspectives of how you say it might be different, the actual way we conduct the specialty is not really different, and that should probably not be surprising, because many of us who are doing colorectal surgery in Canada have been trained in the United States. So we certainly do things pretty much in a similar way. As far as the society is concerned, it's perceived as being the premier organization for colorectal surgeons, not just by Canadians, but by people throughout the world. And everyone wants to have their research presented during the annual meeting of the American Society of Colorectal Surgeons. The journal of the society, Diseases of the Colon and Rectum, everyone wants to have their research work published in that journal. So I think that that's very important. If I can put in one tiny little plug talking about the American Society for the Canadian Society of Colorectal Surgeons, that had a lot of its growing pains, I can tell you that for sure. When we first wrote to Royal College and said, why don't you have this listed as a specialty, we got a letter coming back saying, well, how do we know that anybody's even interested in this specialty? And so that was the stimulus for formation of the society. And I can tell you that it's now well on its way. In Canada, we have a number of training programs for colorectal surgery, and the trainees who complete the programs can now sit for exams for which they can become certified.
Right. What do you say about the health of the specialty of colorectal surgery?
Well, I think the health now is actually quite good. Over the years, I can tell you that there have been many individuals who have not been supportive of this specialty, people who have been working in institutions and have had great influence in them. But the number of those individuals now are certainly decreasing. And I think that more and more people, even those who previously did not think that colorectal surgery was an important specialty, have changed their minds. I believe that virtually every university is looking for a colorectal surgeon for their staff. And to maybe answer your question a little bit about what I think about it, luminaries no less than Professor Gallagher made the statement that we cannot expect a surgeon to be an operating virtuoso in more than one or possibly two areas, and you can't expect them to do better and get better outcomes than the people who specialize in a given area. And I can tell you that when I was preparing for my presidential address, I reviewed the history of the society back to 1910. And there was never any shortage of prophets of doom for the specialty. People who thought that it was going to absolutely disintegrate, it was going to disappear. But have we disappeared off the face of the earth? Absolutely not. In fact, I think that the people who are applying are now amongst the best and the brightest of all the candidates of the surgical residents who are applying for a specialty. So, as I said before, if we do good work, if we conduct research, and if we have good outcomes, I think the future of the specialty is very good. And the bottom line is, it's what's the care of our patient. If we have good care for our patient, that's the most important thing.
Well, Phil, I appreciate your comments. Anything else you'd like to add before we close?
Well, the only thing I might add is that I think that we'd like to tell the younger members of the organization, of the society, that they should help and try to promote the specialty. And I think that they should learn and try to understand what our forefathers have given them. If I might make a quote of Dr. John McCrae, who wrote the immortal poem In Flanders Fields, obviously written in an entirely different context, but he said, "To you we throw the torch, be yours to hold it high." And I think that it's very important that they take pride in the specialty. And I will just give you one more quote of the famous oration of Dr. Mike Weidenhammer, who quoted a Chinese proverb, "When you drink the water, remember who dug the well." So I think the young members have to understand what has been handed to them, and they should carry on the tradition with a great deal of pride. And with that, I thank you very much for having invited me to participate in this historical review.
Thank you, Phil.